Thank you, Deputy Speaker. I have three matters I wish to ask the Minister questions about today. Minister, in my electorate of Dunkley, we are honoured to have Dr John Clements as a resident in Mount Eliza, who in January this year received an award for the Member of the Order of Australia for significant service to international public health through immunisation programs. I don't have time to read out his entire CV, but he is a public health physician and epidemiologist with expertise in vaccination and immunisation who has worked for the WHO, UNICEF and the World Bank, and was part of the Global Infant and Childhood Immunisation Leadership Team at the WHO. He's worked in more than 100 countries and is an Associate Professor at University of Melbourne and an Adjunct Associate Professor at Monash University. Dr Clements contacted me in July of this year because he had had no success offering his services as a volunteer to the Chief Medical Officer, the Department of Health or your office, Minister, with his wealth of experience. I have followed up, Minister, with your office, as has Dr Clements a number of times, and that offer of assistance hasn't been taken up. So my question is, Minister, given the enthusiasm with which your government has taken up expertise of people in business on things like the COVID Commission, will you take the offer from Dr Clements to provide his extensive expertise in the rollout of immunisation programs as we are moving forward to hopefully a world in which we have a vaccine for COVID-19. My second question for the Minister is something, again, that I have raised both in this Parliament and with the Minister, and I acknowledge that the Minister has responded to me in relation to this issue, but nonetheless it is one that is ongoing. St Mary's and Bellato Road Medical Centres in Carrum Downs and Total Care Medical Clinic run by the amazing Dr Chung in Frankston are both bulk billing GP clinics. They have these issues in common. They are trying to offer that bulk billing service in low socio-economic areas, and I know the Minister is familiar with Carrum Downs and Frankston. They say to me, Minister, that the removal of Medicare incentive item code 10981 has financially impacted their clinics and has disincentivised doctors to choose bulk billing over private patients. They both, as have all medical practices around Australia, experienced both increased costs and increased demand during the COVID period, including, for example, things like making sure the clinic is COVID safe. They are both regularly advising vacant positions across many platforms, social media, formal medical advertising platforms, wherever they can, but are getting little to no response and are finding it essentially impossible to get Australian-trained doctors for bulk billing practices at their practice. They both advise me that being classified as a distribution priority area would be essential and of assistance, and they're not classified as such, and that affects the recruitment, and that they also experience barriers in arranging visa applications from doctors from overseas when they can't fill the positions from local applicants. So my question, Minister, is what is the government doing to deal with issues of GP shortages in outer metropolitan areas, which of course aren't the regional and remote areas that correctly some focus has been given to, like in my electorate of Dunkley, to ensure that constituents in low socio-economic areas have ongoing access to high-quality bulk billing GP services. My final issue and question for the Minister is something that I have written to the Minister about, raised in the Parliament and spoken about publicly. The Minister is aware that Faslodex, a drug to extend end of life, in particular for people with metastatic breast cancer, was approved by PBAC in July for listing on the PBS, and it's now approximately 5 months later and it hasn't been listed. It is a drug that could cost as little as $6.60 a month for women for the last months and years of their life instead of $1,600 a month. So I ask, Minister, when will you apply your promise of listing all PBAC-approved drugs on the PBS, no ifs, no buts, to the metastatic breast cancer drug Faslodex? Thank you.
Thank you. I thank the